age, the marital status, the ethnicity, and the allergies. Now I kind of think about this as this is kind of like what the nurse writes on the top of the chart, even in the computer programs. They'll put here for cough, you know, so it's a one sentence thing. And then what we'll do is come back with our HPI. So introduction is kind of like what the rooming nurse puts in the chart. But for the sake of turning it in for the class, follow all the components that are written. The social occupation, the last normal menstrual period, obviously a female, and current regular and PRN meds prescribed and any over-the-counters that they might take. And then the chief complaint, that's the specific reason for the clinic visit in the patient's words. I have a cough. So the introduction example would be PJ, a 55-year-old married Caucasian female who is a reliable historian and reports no known drug allergy. She's menopausal, works part-time as a secretary for family business. Her current meds, chief complaint, I'm here for my routine hypertension follow-up when I need lab work. So it doesn't have to be anything extensive whenever you're writing it. Subjective data. This is the information that's reported to the clinician by the patient, including the pertinent reason for the visit, the complaint, and/or the problem. If this is a well visit, the clinician should ascertain any particular issues the patient would like to be addressed during the visit. So in other words, you have to ask the person, what are you here for? Are you having any problems? Are you still taking your medications? Those are some easy ways to kind of get that conversation going. Have any of your medicines changed? You know, just generalized, ask them what we have, because if they say, well, I don't know, I'm just here because you told me to come back. And you will get that. And then you're sitting there saying, okay, now what do I do next? Then that's when you start saying, okay, so you're here just because I told you to come back for your hypertension. So I'm going to see that person every 3 to 4 months or every 6 months if you're putting it out. So I don't know, I'm only here because you told me to come in. Okay, so Mr. Jones, has anything changed in since I've last seen you? Have you had any change in your medications? Are you still taking your medicines? And what are they? I don't care if the nurse has just gone over it. I want to see if they know what they're taking, because it's a way to get a conversation started. It's a way then to move to another question of, are you having any side effects from that drug? Are you having any problems with any sexual impotence if you're on any of the beta blockers or whatever it might be? If you're on lipids, are you having any cramps, muscle cramps? That's going to be part of that pertinent positive and that pertinent negative when you're writing that down. Okay? Because then that helps us go into that review of systems and tells us where we're also investigating if there's any problems. The subjective data should include the pertinent positive and negatives pertaining to the chief complaint, either offered by the patient spontaneously or those questioned by the clinician. Now, you might see that your patient's your preceptor that you're running in with, so they're the 5 minutes, treat and street. Do they have any time to ask if there's any positives or negatives if they're spending 5 minutes in there? No, because you're spending 5 minutes fighting with the darn computer. So then where is the patient care going? And if you have listened to that and listened to your patients, you're going to have to then see, you take the good and the bad of everyone that your preceptors, when we talk about the preceptors, so you can put it together so you can develop your own practice. But I'm going to tell you that 5 minutes in and out is not going to be where you're investigating the condition fully and doing your charting at that time and getting your prescription sent to the pharmacy. So you have to start learning right away. It's, throwing you to the wolves. How do I get the information that I need in a short of a period of time, but that I'm investigating the problem fully? The HPI should reveal the patient's responses to his or her symptoms and the effect the illness has had on the patient's current complaints. So I'm here for my routine follow-up because you told me to come in. So we're not having any problems with any sexual dysfunction. We're not having any problems with any shortness of breath or any chest pain. He's taking his medicines. He has been able to purchase his medicines. You can figure out their financial status. He hasn't had anything. I'm thinking this is in my mind. He hasn't had anything that's happened to him between now and then. He's had no events. It should be written in a narrative format. This is where it comes in with that old cart. And you'll see on your SOAP notes that it has old cart written in it. And I would encourage you to that. The old cart is good because it stands out, the length of illness, how long they've had it, any characteristics that lead to it. But you know, it's really, if you just write short, like we presented, just very short, and put it in a little bit more of a narrative format, to me it makes more sense. Otherwise you're just doing that bullet thing for old cart and nobody uses them in clinical practice. Each medical complaint or illness needs to be addressed comprehensively when performing a comprehensive SOAP note. I tried to do this, but I have on my Mac and I didn't save it right. But in the past, we wanted you to do like 6 notes. We are only requiring 3 comprehensive notes. And I think that Dr. Barker has made one that's going to be due in about 2 weeks. And some of you might not be in clinical practice at that time, or you're just getting started. So, you know, talk to your clinical faculty about that. That's always a little bit of negotiation on a one-to-one level, okay? Now, they will come in there, so try and get it in, but just let people know so that we can definitely, as clinical faculty, can make any changes for you. Well, as didactic faculty, I guess, but tell your clinical faculty and they can call us. We recommend the use of this OCART to guide the complete history of the present illness, but remember that OCART is actually onset, location, duration, and so on. Okay, so it's an acronym that helps you remember what you need to ask. Pertinent history. If child, you need to list the childhood illnesses, either acute or chronic. If adult, list the medical history, surgical history, the date of the surgery, the OB-GYN history, and psychiatric history for the pertinent history. You also need to list the immunizations and screening tests pertinent for the adult or child. Now that we've gone into this meaningful use system, you're going to see that all these things are coming up that your patients are going to have. So, you know, some of that can be done by the nurse, but some of that you're going to see that you as the provider are going to be doing. So it's really, as far as your exercise, you need to have it listed in there. But it really is something that everybody, you know, that it's all about generating money, I hate to say. Yes?
Can we get a copy of these?
Yeah, this should be in your,
It is in Blackboard? Okay.
in your
Yeah.
clinical information.
Okay.
So you want to look at that. Now, back to, we want to list our medications, our allergies, our alcohol, tobacco, illegal substance use. That's a biggie. People don't want to say that. It's also important to list drug allergies and interactions that family members may have experienced as well, such as anesthesia, antibiotic reactions, you know, because they're going into a lot of this. Do we need to do that testing, that genome testing? If somebody in the family had an allergy to sulfa, then are you going to be more likely to have an allergy to sulfa? It's not something that you see a lot in use, I don't think, but you know, I'll ask people, and if they say, oh, well, I don't want to take it because a family member, then I actually list as an adverse reaction. Okay, I don't put it as an allergy, because if you put it as an allergy, you're leaving that out. But an adverse event or an adverse reaction, that's personally in my own charts that I do, then I know that I'm going to stay away from that drug. Okay, and then you can come back in and make a note, family history of allergy.
I just say for people that don't work with peds, my brother almost got a full workup with LP and all this stuff because he thought he had meningitis. He was 12 years old. He was drinking really heavily. Nobody knew because nobody ever asked him about this stuff. And I have parents all the time that get pissed when I ask about their kids, like, do they drink, do they whatever. We see it all the time in the ER, so don't hesitate to ask your kiddos about that because they do it.
Oh, yeah.